Hear me now? Uh, we have lost like 20 minutes of our lecture, our discussion. That doesn't really matter because we are here to discuss a topic today that we have discussed before: surgical infections. We have touched on this before, and you have been tested on this before. So I don't think that lost time would mean much. How would you define infection? Infection is a process whereby microorganisms like bacteria or fungi or viruses, they, what do they do? They have to have an intrinsic or innate capacity to produce disease, to cause disease. If you consider this, our bodies, our skins, they are crawling with microbes all the time. But not all of them cause disease all the time, right? Our mouth, our nose, it harbors so many types of microorganisms, but they do not cause disease all the time. Some of them do not have the capacity to produce disease in a human, and others do not produce disease in a normal kind of a human, either by invasion or toxin production. Now, all three of these agents, they can act either by direct invasion or through toxin production. For example, in the case of tetanus, yeah, tetanus organisms that act through toxin production, and there are many others. We'll come to that in a bit. Insufficient numbers. At times, it so happens that microorganisms, they are present or they invade the body, but their numbers are small. They are insufficient, and the body's response, it deals with them very effectively, and so they are unable to produce disease. So, in order to produce infection, they have to be present in a certain amount or certain number. They gain access and breach the body's defensive barriers. That is obviously a must. It has to be either the skin or any of the body's tracts or any of the other body organs. And they initiate an inflammatory response resulting in injury or damage to the body or its tissues. Hence, infection is an identifiable source when you can identify one of these things, identifiable source of microbial insult. Normally, microorganisms, we have already sort of looked into it, are prevented from causing infection in the tissues, human tissues or animal tissues, by certain barriers or certain mechanisms. These namely are, what are they? Skin, that is the number one barrier. Intact skin is one of the greatest barriers that the human has against all sorts of external forces, external agents, whether they be microbes or other physical agents, right? Then there is this chemical agent, acid in the stomach, the low pH. It actually deals with so many different kinds of microorganisms that we can ingest in our normal diets. This low pH, it takes care of most of them very effectively. So there is skin and chemical factors like the low pH in the stomach. Then we have, what are these? These are antibodies, the humoral factors, antibodies, complements, opsonins, which deal with so many of antigens that enter or access the body. In addition to the humoral component, there is the cellular component, which are the neutrophils and the phagocytes, macrophages, which actually, this here is an example, which actually ingest and get rid of most of the microorganisms that gain entry into the body tissues or the streaming blood. Okay, now with all these systems that we've looked into, active, why should a person get infected? Because there are certain risk factors. There are certain risk factors which predispose this patient or make him more susceptible. There are certain conditions that would make anyone more susceptible to catching these infections or being affected by microbes. These can be classified into general factors, and these would include metabolic factors. Oops, let's go back on that. Metabolic factors, for example, malnutrition, including obesity, or it can be emaciation or protein deficiency, and metabolic diseases like diabetes and uremia and jaundice, or it can be disseminated disease like cancer or AIDS, which reduce the immunity of the system or suppress the immunity of a person. And in addition to these two factors, in addition to the metabolic and disseminated diseases, there is iatrogenic factors. And they include conditions like radiotherapy and chemotherapy or steroids. When these agents are being used to suppress certain disease or to treat certain disease, on one hand, on the other hand, they would be um, making the patient more prone to getting infections, right? Someone with the bronchial asthma who's on steroids, or someone with the rheumatic arthritis taking a lot of steroids is much more prone to getting all sorts of infections than any other normal person. Then we come to local factors. These would include trauma, namely trauma. Why? Because trauma is the agent that would render the most effective organism or most effective organ of the body's skin, the most effective barrier, ineffective. Okay? It causes a breach in the skin and makes it more susceptible to um, entry or access by any sort of microorganism. Then we have obstruction. Why would there be obstruction? When there is obstruction to the flow in any of the tracts of the body, that would result in staying up of fluids or initial, yeah, proximal to that obstruction. This stasis and these pent up secretions are a living house for a culture medium for growth of microorganisms of all sorts. And then there is ischemia. Ischemia, well, it only means that there is no blood supply to that area, which means that there would be no phagocytes, no macrophages, no WBCs, no soldier to clear off any microorganism invasion. Other local factors include poor surgical technique, which would mean that there could be would be excessive tension on the tissues, or excessive damaging of tissues during surgery. Then there could be presence of dead spaces. Here you can see that there is a lot of space around this bone, which can collect hematoma and seroma, and these would again be ready culture media for the development of microorganisms. When these spaces are present, they have to be sort of taken care of by inserting closed drains or filling these areas up with antibiotic or antiseptic granules to make sure that the dead space is occluded and it would not give way to microorganisms. Then foreign body. It could be an accidental foreign body or it could be a surgical implant. Whenever a foreign body or an external element is present inside the body, it is a nidus for um, microinvasion. Okay, now we are going to look at certain terminology or certain terms that are used in the context of infections. You have heard them before, and these namely are SIRS, or the Systemic Inflammatory Response Syndrome. Syndrome, as the name implies, it is a set of or a bunch of certain symptoms and signs put together that defines this thing. Then there is sepsis, and severe sepsis is synonymous with sepsis syndrome or MARDS, the multiple organ distress syndrome, MSOF, multi-system organ failure, then septic shock and septic screen, वगैरह वगैरह. And now we'll look at all of them one by one. SIRS, as we've already said, K is a bunch of signs and symptoms. These include these signs and symptoms. Any two of these, they have to be present at a given time for the condition to be defined as SIRS, yes, systemic inflammatory response syndrome. Okay? The temperature has to be more than 38 degrees or less than 36 degrees. It could be hyperthermia or hypothermia. Heart rate more than 90 degrees, respiratory rate more than 20, a WBC count of more than 12, or a suppressed count of less than 4,000. Okay. Or there would be hyperglycemia of more than 140 with no evidence of diabetes. See, this SIRS or inflammatory response syndrome can be associated with many types of conditions. It can result from severe trauma. It can result from severe burns. It can be associated with pancreatitis, and it can of course be the result of infections. Whenever it is associated with a suspected source of infection, SIRS, plus a suspected source of infections, this is called sepsis, right? So these symptoms plus any of these sources, pneumonia or UTI or skin infection or abscess or anything of the sort, or an identified positive culture, blood culture, sputum or urine, together these features make sepsis. This thing alone without an infective source is SIRS. When an infective source is identified, the two are together called sepsis. When these two factors, they together result in dysfunction of any organ system of the body, okay, any one organ system of the body, the result is called severe sepsis or MORDS, yeah, multiple organ dysfunction syndrome. This can be indicated by renal dysfunction in the form of a creatinine more than 2, or respiratory dysfunction or hematologic dysfunction. Okay? Platelets less than 100 and INR more than 1.5. One salient feature of this entire stage is a lactate level of more than or up to 4. This means this is a sure indication of presence of organ dysfunction syndrome. If this entire scenario results in the collapse, result in the circulatory system giving up, okay, when the systolic blood pressure is less than 90 and the mean arterial pressure is less than 70, then it is categorized as septic shock, right? So these are the different terms that we use in the context of surgical infections. Okay, now we see that surgery and surgeons encounter infections in two basic ways. Okay, patients who have an infection and require a treatment, they come to the surgeon for that surgical treatment. For example, abscess drainage. This here is a picture of a breast abscess, and the lady would obviously present it to the surgeon for drainage. On the other hand, the surgeon can come across a surgical infection in a way that he operates on, say, a hernia, a clean procedure, or thyroid procedure, but during the course of surgery or in the post-operative period, the wound gets infected. Okay? The initial situation was clean, but got infected later, and here the initial problem was an infection which needed surgical treatment. Now we will look at all of them actually. Surgical first, those infections that require a surgical treatment. These can be either common localized kind of infections or very specific kind of infections. There are three in each category actually. We'll look at all of them. Okay, now let us look at this scenario. A 10-year-old boy presented with painful swelling in the neck and fever for 3 days, right? On examination, he had tachycardia, the temperature of 102 degrees Fahrenheit. Local examination is as follows. What do you see here? This here is a swelling, sort of in the submandibular region. It is reddish. You can see the redness. It's tense, as you can see by the shine. There is, and it is tender and hot. That is something that you cannot see on the picture, but it is a part of inflammation. And what is your diagnosis? It is an abscess. Great. And what is an abscess? Abscess is a localized collection of pus. And what is pus? You see here, these all are examples of tiny little abscesses. This tiny little boil, or this little boil or furuncle that you would call, they are all tiny abscesses, and they contain this white thing called pus. Pus is composed of dead and dying white blood cells. And what organism is most notorious for causing pus? Formation of pus? Staph aureus. Here is another example of pus collecting in the nail folds. This is paronychia. Paronychia is when the lateral nail fold is affected, and it is called eponychia when the entire or the proximal nail fold is affected, right? It starts as cellulitis and progresses to an abscess form. This here is another example of abscess. Here you can see the upper outer quadrant of the buttock or the left gluteal region. It is affected, it is red and swollen. And here you can see the entire arm, the upper arm is red edematous, swollen. And what sort of an abscess do you think this would be? It's an injection abscess. Both these areas are both these areas are those which are affected by intramuscular, which are the sites for intramuscular injections. And if an improper or dirty needle or dirty syringe is used to give an infection, this can be the horrible result of that sort of an infection. These two are the particular sites. Then we come to this. What do you think is this thing? This is a very characteristic site. It can happen on the back and other parts of the body, but this is a very characteristic site for something called carbuncle. This is a particular infection which affects usually the diabetics. What happens is that there are multiple, you can see this, multiple openings in the skin or multiple discharging sinuses. In this entire area, the subcutaneous tissue, it is infected and becomes laden with pus, and then it finds or tracks through along with multiple hair follicles to get to the surface to be able to drain, right? This is very particular to diabetics in most cases. Now we come to the treatment of abscesses. Abscesses need drainage with curettage. Okay, here आप देख रहे हो paronychia is drained. A tiny stab incision is made in the nail fold and the pus is drained. And then there is curettage. What does that mean? This tiny spoon-like thing, it is used to curate or scoop out all the surrounding area, the area surrounding the abscess cavity, which means the granulation tissue which produces the pus. In case of the carbuncle, however, this entire area is excised. Here, a drainage will usually not serve the purpose, so this entire overlying area can be excised to remove the affected area, and then this entire thing heals by secondary intention, right? Okay, second scenario. Our next scenario is that of a young boy who was brought to the hospital with a diffuse redness and swelling of the left eye 2 days after he accidentally scratched it. He had a pulse rate of 120 per minute and 102 degrees Fahrenheit of temperature. And this is kind of how he looked like. आप देख सकते हो in comparison there is slight redness and diffuse swelling of this area. There is no pointing and you cannot really make out any pointy pussy area. This diffuse swelling and redness is called, or it's a part of, cellulitis. And what exactly is cellulitis? Cellulitis is infection of the subcutaneous area, the subcutaneous plane of tissues. These are other examples of cellulitis. Here you can see that cellulitis, that is the redness, is associated with swelling, edema, that is one feature, or blistering. When serous fluid it collects to the surface and it needs an outlet, right? And here the blisters are broken, resulting in scabs. It is basically non-suppurative in nature. Either there is no pus or the pus that is present is thin, watery kind of pus. It's called a dishwash kind of a fluid. It is poorly localized, unlike an abscess, which is usually well localized. The cause of these can be streptococci, some types of staphylococci, or some clostridia. In cases of cellulitis, SIRS, a systemic inflammatory response, is more common than an abscess. Abscess, if it is large, will result in SIRS, and if it is associated with cellulitis. But if it's a tiny little abscess confined to one particular part of the body, it might not have any systemic symptoms at all. Cellulitis, on the other hand, almost always has surrounding fever, fatigue, and tachycardia. Systemic features are more common with cellulitis. Before discussing the treatment of cellulitis, we are going to deal with this scenario and then we'll discuss the treatment of both these things together. A manual laborer, he suffered an injury to his hand during the course of his work. He neglected the wound which got infected. 3 days later, he noticed red streaks on his arm and painful nodules in the axilla. He also developed a high grade fever, and this is what he looked like. Here you can see the arm, and there are absolutely red streaks running from the hand towards the axilla. And this is lymphangitis. What is lymphangitis? It is the spread of infection along the lymphatic channels, producing the characteristic red lines of lymphangitis and enlarged tender lymph nodes of acute lymphadenitis. Here you can see, this is so clearly evident, this is the wound that got infected, this initial cellulitis. Here from the line of lymphangitis runs and goes to the first draining lymph nodes in the axilla, where the lymph nodes would also be swollen and tender, right? Lymphangitis and lymphadenitis. Cellulitis and lymphangitis are treated similarly with the use of broad spectrum antibiotics, oral or injectable depending upon the severity, and non-steroidal anti-inflammatory drugs to encounter inflammation and ease the pain. Rest and elevation of the limb, it is very important. Sorry. Elevation of the limb to reduce the edema and tension in the limb, it is important in reducing not only the pain but speeding up recovery. and supportive treatments are for systemic features like fever. Okay, next on. Now we come to the more specific kind of surgical infections. A 60-year-old man underwent above knee amputation for peripheral vascular disease. Peripheral vascular disease, right? And the result was dry gangrene. 2 days later, 2 days after the amputation, stump started turning black and developed blisters containing dark fluid. See, यहाँ पे already patient की हो चुकी for dry gangrene, which was the result of peripheral vascular disease. After amputation, after the closed stump and after the wound had been closed, 2 days pass, and what you see is blackening of the stump and blistering of the area. The vital signs of the patient become suddenly deteriorated and heart rate of 120, pulse BP of 90/60, and respiratory rate of 30 times per minute. His temperature was, however, subnormal. This is what he kind of looked like. This is an amputation stump, an above knee amputation stump. Okay? And here you can see the area of the multiple areas, dark and black areas, black patch, and multiple blisters. They contain brownish or dark fluid. This is gas gangrene. Okay. And what is gas gangrene? It is an infection caused by Clostridium welchii perfringens, which is a gram-positive anaerobic spore-bearing bacillus, which is commonly found in soil and feces. Spores are commonly found in soil and feces, and if this is the basic source of this bacteria, then what sort of wounds do you think would be most infected or likely to get into problem? High risk cases are military and traumatic cases, obviously, which are severe kind of cases with lot of necrosis and tissue damage. Colorectal operations, immunocompromised patients, diabetics, those with malignancies, and those with wounds containing a lot of necrotic tissue or foreign material in it. And this is kind of what it looks like. It is a very aggressive form of infection, and it can kill your patient within hours. If you do not act immediately, you can lose your patient before you know it. There is severe local wound pain and crepitus. Crepitus is due to presence of gas in the tissues. This gas gangrene is also called clostridial myonecrosis. It's because gas is present in the muscles, and it is also indicated here on an X-ray. See these black areas, the blotchy black blotches. These indicate the presence of gas in the muscles. Clostridial myonecrosis. It's because the Clostridia they use the glycogen present in the muscles as food, and the resultant formation of carbon dioxide and various gases, which give this picture and crepitus on clinical examination. The wound produces thin, brown, sweet-smelling exudate, which gram staining will reveal on gram staining will reveal the bacteria. There is edema and spreading gangrene, which follows the release of enzymes like collagenase, hyaluronidase, and other proteases. It spreads very, very quickly. If the foot is infected today in the morning, the entire leg may be involved by the evening, and the patient may be dead by the night because systemic complications with circulatory collapse it occurs within hours. Treatment: antibiotic prophylaxis in patients at risk is important, especially after amputations for peripheral vascular disease. Why peripheral vascular disease? Because these areas they have low oxygen tension. Okay? When blood supply is compromised, they have low oxygen tension, and Clostridia thrive in low oxygen tension. They are anaerobes, right? Treatment: large doses of intravenous penicillin. Thank God for that they are sensitive to penicillin. Has to be aggressive debridement of the affected area, and more often than not, it has to be amputated. Hyperbaric oxygen, which means oxygen under high pressure. It is controversial because it is rather hazardous, but it can be administered. The patient is placed in oxygen tent and oxygen compartment, and the air pressure of that compartment is raised in order to make sure that there is tissue that the tissues get perfused with oxygen. It is controversial, however. Next on, we have a newborn delivered at home by a dye, sorry, this is wrong. It has to be a dye and not a dia. And the umbilical cord is clipped in very septic conditions or dirty conditions. He is brought to the emergency room, unable to suckle, and he has a high grade fever and he is in spasm. Okay, something like this. And you know this very well. This tetanus, the causative organism is Clostridium tetani. Pathogenesis, okay. The organism in this condition or in this infection does not usually um, do what? Do a major scale invasion. Actual microorganism may be sitting in the tiniest little wound somewhere in the body, a tiny crack or a tiny little pinprick or something like that. And from there, what it does is it secretes exotoxins like tetanospasmin, which affects myoneural junctions and the motor neuron cells of the anterior horn of the spinal cord. Herefrom, it causes spasm of the body muscles and exhausts the patient. It can cause death by what? By the spasm of the respiratory muscles. These are the various other features that can result, symptoms that can result. This is trismus or lockjaw. The mouth of the patient is so tightly clenched that the patient can actually die of starvation or lack of hydration. It is really difficult to achieve to open the mouth of this patient in order to give them any sort of nutrition or fluid. There are seizures which are a part of this, and this is a rather extreme form of this when there is a opisthotonus or spasm of the extensor muscles of the body. Um, Treatment. In case of Clostridium tetani, well, it is most importantly said that prevention is far, far superior or more important than the treatment of this condition. Prophylaxis with tetanus toxoid is the best treatment or preventive measure, right? Treatment in an established case, just a minor debridement of the wound, antibiotic treatment with benzyl penicillin. Relaxants, they have to be needed if there is spasm to break the spasm, and ventilator or ventilation may be needed in severe forms where there is respiratory spasm or respiratory. And the use of antitoxins is absolutely the most important thing in the treatment of either an established case or even in suspected case or likely case. It should be given human immunoglobulins. They ought to be given in both at-risk wounds. For example, the one that we've already discussed, peripheral vascular disease, amputation, or someone with colorectal surgery and peripheral vascular compromise of any sort. Such patients, they should receive antitoxin or human immunoglobulins as a preventive or preventive measure. It should not actually wait for the infection to settle in. Next, we come to a 50-year-old diabetic lady who was brought to the emergency in a state of shock. 4 days after she had a small mole excised from her abdominal wall. Her local examination revealed this horrible scenario. You see that the entire wall is gangrenous. The overlying skin is not as it is scary, but it's not as scary as the inside. The inner extent is far worse than the outer appearance. This is synergistic spreading gangrene or necrotizing fasciitis. ठीक है? If this condition affects the abdominal wall, then it is called Melanese synergistic gangrene, right? It is a subdermal spread of gangrene is always much more extensive than it appears from the surface. Untreated, it will lead to widespread gangrene and multiple multi-system organ failure. Now, this synergistic spreading gangrene, it may sort of, on the first look, sort of remind you of or look like gas gangrene, but इसमें the extent or the damage is mostly subdermal. Gas gangrene, on the other end, was a myodermal or a sorry myodermal named myonecrosis, a clostridial myonecrosis. Here, the cause is not Clostridia. Synergistic gangrene is a polymicrobial infection. It is caused by a combination of coliforms, staphylococci, bacteroids, which means that there is gram-positive organisms, gram-negative organisms, and anaerobes all together. In anaerobic streptococci, they all they all act in a synergy to produce this condition, and the patients would obviously have to be immunocompromised and diabetics. This is a picture of Fournier's gangrene. We just saw that when synergistic gangrene affects the abdominal wall, it is called Melanese gangrene. But in effect, it is damaging or affecting the perineal area or the scrotal area. It is called Fournier's gangrene, right? These patients have to be immunocompromised, almost always diabetic. The initial injury or the initial wound may be very minor, but it is severely contaminated and it spreads rather quickly. It's extremely painful. These patients need a broad spectrum antibiotic therapy. Unlike gas gangrene, when penicillin was our choice, right? Here we need a broad spectrum antibiotic therapy which will include gram positive, negative, and anaerobe, at least all these three lines of microbes. It also needs aggressive circulatory support in the form of fluids and, if need be, in the form of inotropic support, because otherwise our patient will collapse in no time. Locally, there has to be extensive debridement or amputation if need be. Okay, next we move on to the scary picture. This is post-surgical wound infection. Post-surgical wound infection or surgical site infection or SSI. This is a wound which was initially closed after surgery. It looks like a Phelan-Stevenson, initially closed, but has opened up because of infection. Sometimes after, say, a week or so after surgery, and this is what it looks like. The major and minor surgical site infections. So surgical site infections can be classified into major or minor surgical types. Minor SSI, when wound infection happens, but it is usually minor. There is a little bit of pus discharge and should not be associated with excessive discomfort. It would look something like this. One or a couple more of stitches may be infected. You open the stitch up, the pus is discharged, and the wound becomes okay. And the patient doesn't have to stay there for a long time. Major SSI, on the other hand, is a condition when the pus discharge is copious and enormous. It needs a secondary procedure to drain it. It increases or lengthens patient's stay in the hospital, and it really affects the patient's overall well-being. And this here is the example of that. Another type of classification involves the layers involved. Um, when the superficial surgical site infection, when the area involves only the initial incision or the skin incision area, it is called a SSSI, yeah, superficial surgical site infection. When it involves a deeper area, like that is the skin and the subcutaneous tissue, then it, or maybe the muscles too, then it is deep incisional SSI. And if it involves the organ space or the space or the organs underlying the incision, then it is called organ or space SI. For example, of this would be pelvic peritonitis following a laparotomy for something, or a development of a diaphragmatic abscess or any sort of an abscess in the peritoneum after laparotomy, right? Third type of classification, it depends on the amount of wound contamination, right? Such wounds are described as classified as clean class 1, clean contaminated class 2. बस ओके ठीक है बंद कर दें या एक एक कर लें ओके थैंक यू The third type is clean contaminated and dirty infected wounds. This is an important university question from your point of view. Clean wounds are the ones which would be when there is no acute inflammation anywhere, when none of the body tracts is open, respiratory, GI tract, biliary tract, none of the tracts are opened, and there is no breach in aseptic technique. Okay, where the infective risk is less than 2%, or this involves like something a breast biopsy, a thyroid surgery, or hernia. A clean contaminated or class 2 wound is the one when the body tracts are entered but in a very controlled kind of way, and there is minimal spillage, something like that. Okay? There is no gross infection anywhere. Here the infective risk is less than 10%, and the example of this is a cholecystectomy. Third, or class 3 wounds are contaminated wounds when there is infection, but it is non-purulent in its nature. There is no frank pus anywhere. There is cross spillage from the gastrointestinal tract, or there is a penetrating traumatic wound of less than 4-hour duration. 20% has may infection rate, or class 4 wounds or dirty wounds are the one when there is purulent infection, or preoperative perforation of viscera or penetrating trauma of more than 4-hour duration. यहाँ पे 40% है rate of infection. And I think we have to stop here because the time is over. Thank you so much and thank you for your attention. हाँ जी बेटा कर दें कैसे बंद करना है